Hi everyone, welcome back to my channel. I'm Dr. Lisa with Private Practice Made Easy, Your Turn to Lead. And in this video, I'm going to talk about the importance of building relationships with your patients. Oh my gosh, I got a hair in my mouth. And being able to retain these patients, because it's not just about gaining new patients, but it's about keeping the patients that you have. So let's talk about healthcare in general, especially in mental health. It's not just about prescriptions, diagnoses, and test results. It's about people, and building a relationship with your patients is the foundation of trust. And without trust, it's really hard to gain real progress, especially in mental health. So studies have shown that patients are more likely to follow your treatment plans and report symptoms accurately when they feel heard. When we build rapport, we reduce the fear and anxiety that opens the door to real healing. So it's important to build those strong patient relationships. So this is what I want to talk about, some strategies, 5 strategies. Number 1, be present. Put the screen down, make eye contact, and really listen. Now, I have a lot of issues with remembering everything a patient says. So I am constantly wanting to write down notes as they're talking. But then I lose the connection, I lose the eye contact, and they feel like I'm more focused on the screen than I am on them. And one solution is Heidi AI, and I have another video about Heidi AI. It'll actually listen to your whole conversation and do the notes for you, so you're not missing anything in the conversation. Number 2, validate their experience. Show empathy, even if it's the wrong thing, especially in mental health, right? Or it could be mental health, it could be in primary care, the patient's not maybe being compliant with their medication. Well, because they're overwhelmed or they didn't have time to get to the pharmacy. It's the wrong thing to do, right? And we've got to help them be compliant and figure out where the disconnect is. But we have to validate that, oh, it's understandable that you feel overwhelmed, that you're juggling so many things and it's hard to get to the pharmacy maybe during these hours. So there's a 24-hour pharmacy at this location, or maybe try to have your meds delivered to your home. And there's Optum home delivery, there's Amazon home delivery, and you're helping them with their problems. So while validating their experience. Number 3, follow through. Do what you say you're going to do. Consistency builds trust. If you could say, we're going to try this new medication and I'm going to call you, or I'm going to follow up with you somehow, email, call, or whatever. My office is going to send a referral for a recommendation for a sleep study. Actually follow through. It's frustrating for patients that have to call the office and say, well, I'm at the pharmacy and my meds aren't there, or I was supposed to get a referral and I never got it. So make sure that you follow through. And some of this you can use AI to help you with, or maybe an assistant or a nurse if you're an NP or admin, or someone to help you carry out what you say you're going to do when you yourself are so busy. Number 4, personalize the care. Now I'm going to spend a little bit of time on this, because remember, the small things are important. And so when I'm taking notes, and this might be in the end of the conversation that I have or the session with the patient, I'm going to jot down a few things. For example, patient's birthday's coming up and they're going on a cruise, or they have an anniversary, or they got a new job, or they're getting ready to start a new job. Something, just the little things, their kids' names I always write down, or their dog, their pets, their names. So next time when they come in, I'm like, hey, your pet which is Candy, okay? Candy had to have a surgery, or how's your pet doing at that new doggy daycare that they went to? and say the name of the pet. Those little things really mean a lot and go a long way in building rapport. And as a patient myself, I remember I was going to the doctor and I hadn't been there in 8-10 months. And I was there for just a routine visit. And I remember I had a nurse practitioner, and I remember her saying something very personalized in regards to, I was going on a vacation, how was it, and knew where I was going. I was like, how did she remember that? And this was a long time ago before I was in practice, but I remember that was so genuine to me, and I was able to feel much more comfortable with her, and the conversation just flowed. And I remember saying, I hope that, because it's a big office and there's lots of nurse practitioners in there, I want the same nurse practitioner. Did I just slobber? Anyway, I want the same nurse practitioner. So personalizing your care is important. So jot down, I think I did slobber, sorry. But jot down that information so you have it. Sorry, I didn't mean to do a whole video here with me slobbering. Goodness. Number 5, create a safe space. Always meet your patients where they're at without judgment. No judgment. If they even sniff a little judgment, that is going to close off that rapport, and you're not going to really know what's going on. And so I want to give you an example. So I have probably about 30% of my practice is substance use disorder, and in particular MAT treatment, medication assisted treatment. And we drug test, which are mandatory, but in the initial conversation, when I'm telling them about the program, I'm saying to them, we drug test every month. So if you have a substance in your urine, if it comes up, this is not going to throw you out of the program. It is so we know what's in your system, so that we know how to treat you in regards to, maybe they're smoking marijuana, right? And they're being treated for opioid use disorder, but they're smoking marijuana. Well, maybe we need to have our LCDC talk to them about cannabis and whether or not that is a good thing for them to be doing, because high doses of THC can actually trigger psychosis. But anyway, that's a whole nother video, right? But it's important for them to know that I can actually go with this program because they're not going to judge me, and that, okay, it's not condoning what they're doing, but I'm not going to get kicked out of the treatment facility. And we call that harm reduction. Again, that's another video too. But let me go back to what I was talking about. Creating a safe space. Make sure that you're not being judgmental. Make sure you are cultivating a space where they can talk about anything. So some of the most important moments in your career didn't come from that perfect diagnosis. So if you can think about where you made a significant difference in your patients, that conversation, maybe just checking in with someone or just listening. People remember how you made them feel, not just what you prescribed. So anyway, you're going to keep your patient if you build these relationships. So I hope these 5 strategies really help you out. And lastly, you're going to lose patients. That's inevitable with insurance changing, or people changing jobs and insurance changing and things like that, or people moving out of the state. You're going to lose patients. That's going to happen. But it is really a goal to keep as many patients as possible. And at our practice, we are trying to keep 80% of our patients. 80%. And that's our goal. So have a goal, and then figure out, if you do lose patients, figure out why you lost them. Was it because you weren't accessible? Was it because they moved? Was it because of insurance? Keep track so that you can really gauge how many patients you are retaining. All right, now that's it. Again, sorry about me slobbering all over the place. Have a good day.